So, talking about PRN medications, do you guys remember what PRN means?
As needed.
As needed, yes, ma'am. So, medication aids must have written physician orders to include the reason for giving, the exact dose, exact time in 24 hours, and what to do if the symptoms persist. Now, that being said, I've never had a doctor really give me an order for a PRN medication and put the reason for giving, the exact, well, it always has the exact dose and the exact time, but not what to do if the symptoms persist. Most of the time, you'll just be calling the physician at that point, or your charge nurse or medical supervisor. So a refusal of medication. So we know by going over the client rights, they have a right to refuse medications, correct? Okay, so why do you think a client would possibly refuse medication? Rash. So can you think of anything, Tracy, why they might refuse a medication?
And someone said that the way the medication makes them feel.
Right? Yes,
Okay.
ma'am. What would be, okay, think about this. What if the medication actually made their symptoms worse? So like if they take something for anxiety and we learned previously, it could maybe cause increasing suicidal thoughts if it's a depression medication. A medication for anxiety, we read earlier too, that could make people nervous as a side effect of it. So maybe it exacerbates their symptoms or worsens them. So how would you handle a refusal?
We talked yesterday, Dylan, about documenting that.
Yes, we would definitely want to document it. But how would you handle it? I would like to know how you will handle it with the actual person. Why don't we, okay, I'm going to be a client right now, and you guys are going to be giving me my medications, okay? So I'm going to come up to the nurse's station, and you give me my little cup of medication that I'm supposed to take. I'm not taking that yellow pill. That thing makes me sick as a dog. And there's nothing you could do to make me take it.
I know if someone told me that, I would just ask questions like, how is it making you feel? Just get, more detailed information from them.
Yes. And would we want to push that medication, like sit and say, try to convince them to take it?
No.
Well, we could kind of recommend, we could say, well, and it depends on too how it's making them feel, like Tracy said. If they're saying, oh, it's making me vomit every time I take this medication, we can, that's pretty understandable. I wouldn't want to take it either. But if you have someone and they're just saying, oh, well, I don't want to take that medicine because I don't need it anymore. So maybe it's a mental health medication or a heart pill, and you could just say, well, right now your doctor thinks you should continue to take it. But if you don't want to take it, we can document it as a refusal. It's just best. I always say it's best to adhere to your medication regimen as it's prescribed because it's there for a reason. And if you don't want to take it, I mean, that's your right. It's your body. But you would definitely want to talk to your doctor about it.
Some medicines like that'll make you tired or something like you first.
Yeah.
But then once your body gets used to it, it don't have that effect.
That's true. And that can be the fact with some depression medications. Sometimes it takes a whole, a few weeks to a month to get in their system fully. So people will be like, this depression medication is not helping me at all. It's not doing nothing. All it does is make me tired. And that's a common side effect, especially when you start taking those. But, we can just say, you know what? It takes a little bit for that to get in your system. You should, I encourage you to adhere to your medicines as prescribed. But if you don't want to take it, we'll document it as a refusal, but we definitely need to be talking with your doctor.
Just don't try to push.
Yeah, don't ever force medication, but you can always reiterate the importance of adhering to a medication regimen. And if it's something that, they just can't do, it's something, we need to talk with the doctor about. So, any questions on that? Because sometimes a refusal of medication you think would be very easy, especially like we just talked about it. But what happens if you get a guy who's already upset because his family members quit, they cut him off, and he's not been able to get his ID in the mail, and Social Security denied him for a claim, and all this stuff, and he starts getting very agitated, and he says, I'm not taking that blank medicine, or starts using some foul language. Do you think you can still hold your composures and say, it's okay?
At that time, I think you probably just might be even probably recommend just maybe document it.
Yeah, at that time, it's probably it's better to say, hey, let's let this situation cool off a second. And, and we could just say, that's fine. If you really don't want to take it, it's your body and it's your medicines. We'll just document it as you refused it. And lots of times they'll cool off because they're just mad about something else already. I mean, nobody would really get mad about a refusal of medication, but they're already mad about something else. So the big picture, I guess, would be to just say, hey, let's let them cool off a minute. We'll go ahead and mark it as a refuse. And I have had them come back like 15 minutes later and say, you know what? I apologize. I shouldn't have acted that way. And I really do need that medicine. I know it don't make me feel too good, but I thought about what you said.
Don't drink that way with a mark.
Okay. So, and I'm glad you asked that question, because correcting a mark is kind of a different thing. So, so let's say we have a MAR, and you initial it, and then you circle it. You could always take what you initialed and circled, put one line through it, and put your initials above it, and put error. That's how you mark a mistake out. You never want to mark it out. Like, if you're at home and you're writing something down and you say, I just want to mark that word out, so you scribble it out real good. Never do that on a MAR. Never white a MAR out. Never use white out. It's totally against the rules, and if law enforcement was to ever have to go back and look at some of those things or an investigation, they're going to say, well, why is it scribbled out, and why are we using white out? So never ever use those things. So you would just put one line through it, put error, put the initial right up above it, even if it's tiny. I mean, I know those blocks are tiny, so tiny writing. And then we could turn over on the back and say, put a little note and say, error in documenting, client came back and wanted to take his scheduled medication at the scheduled time.
Just as long as they can face the free.
Yeah, even if it's tiny, I mean, I know that those little blocks are tiny. So, as long as you can tell it's there, and then we could turn over on the back and see what you said about it. So that's pretty good. Any
Hey,
questions?
Dawn, when I get back into the office, can I take a look at some like sample MAR sheets just to see how everything is written and how it's done?
Yes, I'm gonna, you're not with us, you're not here today at BLR, are you?
No.
Okay, so what I can do is, I will just I'll put you a MAR and an order and the booklet in your mailbox.
Okay, thank you.
You're welcome. Okay, so medication errors. What would be constituted as an error? There's one answer that I'm really looking for. Yep, what would be constituted as a medication error?
Giving the wrong medicine?
The wrong medicine. What'd you say, Joey? Wrong pill at the wrong time. Did you say something, Jordan? Wrong pill. So what are we exactly saying? There was things that we went over at the beginning of this course that were 5 things. And I said, the 5 rights. So basically, anything that violates the 5 rights of medication administration is an error. So can you guys tell me what the 5 rights are?
Right time, right medication, right patient.
Did you say the right way of doing it? Sort of shot or?
You said right root, didn't you?
Yeah.
So the right patient, the right time,
Right time, right route.
right route, right medication,
More than anything.
Right dose?
and right dose. So, a medication error could be an administration error, which would be violating one of the 5 rights. You gave it at the wrong time, or you gave the wrong pill to the wrong person. It could be a packaging or pharmacy error. So, in that case, what we would have to do is get clarification from the physician. So, Joey, you go down to the pharmacy to pick up your lisinopril for your blood pressure. You bring it back. I write it on the MAR. I look at the order that the doctor sent in, and it all matches up and it's fine. When I go to give you your medication, you say, wait a minute, I'm supposed to take 2 of these. And I've been taking 2 of these since I've been here. And I look back and I say, well, your doctor says that you only take 1. And the pharmacy says you only take 1. And you say, I don't care. I was supposed to take 2 of these. So when in doubt, what do? We don't give it to them. So what we would do then is we would call the physician for clarification. And I have had that happen here several times because a lot of doctors, what they do is e-scribe, which is they click a button on the computer and it goes from whatever they say to write and it goes straight to the pharmacist. They don't pick the phone up, they don't call it, they don't do nothing unless it's a controlled substance. Then they have to write you a prescription, but stuff like that, they just send it straight through the machine. And the problem with that is we are humans. So if I am writing something and sending it, there's a chance that there's an error there. Now, as to if I am writing it out in a note and then I have to read it back to myself and then read it to the pharmacist, I'm looking at that thing 3 different times, but they don't do that anymore. They push a button and it goes straight to the pharmacy. So, with that being said, sometimes they don't review it like an accuracy review like they should. So, what they'll say is they'll say, "Oh man, that is supposed to be 2 tablets a day." So, what you would do is write out a verbal order, so that way you can get the order changed. And then the pharmacist would need to be contacted. Usually the physician's office will contact them, but they have to readjust that in their system, especially for insurance purposes, because your insurance will say, well, you had 30 of those, it's supposed to last you for a month. But in all reality, if they only filled 30 and they're supposed to take 2, it's only going to last them a half a month. So it's not going to work out correct, and then the insurance won't pay. So if that mistake happens, there's a lot to follow up with to make sure that the patient is taken care of and there's a continuity of care. So if you have an error, what would you do? Incident report, document, those are all good answers. And you're going to call your nursing supervisor. And also, we're going to, after you call the nursing supervisor, we need to tell the patient. And we need to check the patient. The very first thing is check on the patient. So let's say you get 2 pills that shouldn't have been gave. That's not good, because the first thing we need to do is check the patient. You just double dose them. Could be a potential overdose if it's a narcotic. Could be a heart medication that causes a heart arrhythmia. It could cause a bunch of stuff. So lots of times it's best to call their provider and see what they would like to do, or send them on to the hospital and say, look, this is what happened. And then we have to do all the documentation. So we said we're going to document it, and we're going to do an incident report. And then we'll have to go from there. And lots of times after that, it requires a corrective action plan or something stating that in order to avoid the mistake in the future, even though we're humans and we can make mistakes, we have to have some kind of follow-up training to know. So maybe it's a shortened version of this class again. Or maybe it's like the recertification for this class and you just have to go through it again. Or maybe it's a Relias learning, or maybe it's sitting with me and me actually physically sitting with you during so many med passes or something. The worst thing to do, and I never ever want any of you guys to do it, is lie about an error. Do you think you can lie about an error? Sure, happens every day, I think, everywhere. There is probably, I would hate to say it, but there could be healthcare professionals out here that are covering errors up a lot. And, and it happens sometimes. But the best thing to do is to be honest. I'll tell you a quick little story to tell you how important it is to be honest. I was working at another facility, and I was the only nurse, and I had one residential technician with me, and they were cooking and cleaning and getting ready to shut the kitchen down and all that for the night, because we were going to switch off the night shift and go home. So I was doing everything in the nurse's station, reviewing Mars and making sure my counts were right and all that stuff before night shift came in. And I was also supervising 16 patients. And I was also giving 16 patients medications out. and answering the phones and doing pre-screens to come into the facility. So it was like double time, there was a lot going on. And that's really not the best. It's not the best situation to be in because really you should be focused on giving medications when you're giving medications. But this lady came up to the window and she says to me, "Hey, I need a Vistaril." In that place, we had something called a stat box, and you may have that in a place you work at. Because we don't have one here at BLR, but if you was to work somewhere else and use this certification, they may have a stat box, which is a box that a pharmacy provides the facility to say, "Oh, okay, the doctor's prescribing medication in the middle of the night, or he's only writing it for 24 hours. Instead of calling in a prescription, you document that, and then you can get it out of the stat box. You don't actually have to be called to the pharmacy and all that. It's just standing medications." So what she did was she said, "I need a Vistaril." And a Vistaril is basically a souped up Benadryl. It's in the same drug class as a Benadryl. Pretty harmless medication, right? Benadryl, it's over the counter. Most people take it. It's okay. Well, there was also something in there called Librium. Have y'all ever heard of that? It's a benzodiazepine, and I'm not even sure if they make it now. I heard somebody say that they're not making it anymore. But it was a benzodiazepine similar to Ativan. Now the problem with that was the Vistarils, they were in a little punch-out pack, and so was the Librium. The punch-out packs, when patients get them, have a thing across the top and says it and all that. Well, these didn't. They just had a little label on the back of them that was real small. So the problem with it is the Vistarils were green and white, and the Libriums were white and green. So I just picked up a green and white pill out of that box and I punched it out, took it to the patient, put it in a cup, marked it on the paper, poured her a cup of water, and I went to throw that little punch out packet away. And when I just done like that, I saw it said Librium. And I said, "Don't swallow that." And she was right in the middle of swallowing it. "Why? What did I just take?" she says. And I said, "Well, you just took a Librium." I said, "Instead of a Vistaril." I said, "And that's an error." So, one of the first things I did was I finished up my work and I checked on the patient, made sure she was okay. I called the doctor because she had previously been on Librium, thank goodness, just the day before, and it just ran out. So the doctor says, "Oh, it won't hurt her. It's okay. We'll just mark it down as it was an error and go on about our day." Well, I was a brand new nurse, and I felt so bad about that. I called my boss at home that night when I was going to leave work, and believe it or not, I just started crying. And I didn't know what to do because I thought, "Oh my goodness, this is a huge deal. I gave somebody something that could have really hurt them." And I told my boss, I said, "You know what? I quit. I'm not doing this anymore. I'm not coming back tomorrow." And my boss said, "Why don't you just calm down and write up the report and you just come back tomorrow?" She said, "It'll be okay." And I came back in, and the patient saw me, and she could literally see I'd been upset. And the patient said to me, she says, "Oh, don't be upset. It's okay. I won't tell nobody. You don't have to tell nobody." And I said, "Well, I have to because it's ethical. It's honest." I could have wrote down that the doctor ordered her a one-time dose of that and it'd been just swept under the rug. But you need to be honest about those mistakes. Um, so she says, I won't say nothing to nobody. Well, the next morning I did go back to work. Did end up working there 6 more years after that. So I went back to work and the director of clinical operations came in. And she leaned up against the counter. And this person was there for some mental health stuff. So she was kind of her patient. And she looked over at me and she says, well, I'm glad you're an honest guy about that kind of stuff. And I said, oh, yeah? And I thought, well, it doesn't, she shouldn't really be asking me much about it. But she said, remember that patient that said that they wouldn't say anything? I said, yeah. She said, she just told the whole morning group that you gave her the wrong medicine last night. She said, so if you hadn't been honest about it, it would have came out anyway, and it would have been a lot worse if you'd have never said nothing. So being honest and reporting and making your own mistakes, it's going to happen. We are human beings. I didn't get fired. I didn't even get written up. I'm really not sure anything ever came of it. I think the physician did fix it to where she could have had a one-time pill or something, and it was okay. And you know what? I never regret being honest about that. And that was a controlled substance I gave that lady. So no matter how serious the area is, always just be upfront. We can always fix things. The only things that we can't fix are human lives. So I'd rather you be upfront, honest. We can do whatever we need to do as long as the patient's okay. And if we tend to the patient and get them where they need to be to the hospital, or their doctor says send them to the hospital or monitor their vital signs or something like that, as long as the patient's okay, we can fix papers. That's my soapbox for today. So moving on.
So,
Yes.
about the medication, I don't know if we consider here. The reason I asked you where we do working. So say a resident comes in and he says, I'm a medicine mistake. Right?
Mm-hmm.
Document and count it. But it's not all there. Like there's one missing that's in the bottle. Right?
Okay.
How would you go about that?
Okay.
But he's swearing that he didn't take it, he didn't do it.
Okay. I've actually had that happen once. So the first thing to do would be count the medicine, ask the patient, did you take one? If they say no, you can always say, okay, that's all right. Your count is short one. So we're going to call the pharmacy because each one they dispense, they have to keep a count on it. So then we would call the pharmacy, especially a controlled thing. We call the pharmacy and we'd say, hey, look, you know, Jack Black came in here and he had 12 Suboxones filled, and the bottle says 12, and he didn't take any, and there's only 11 in here. The pharmacy would then look back at the count that they took out and see if they made a mistake. And 99% of the time, that's what happens if that happens. 1% of the time, well, you're always going to find somebody who manipulates the system. So in that case, we would say, well, you know, you are short one, and it looks as though we've taken today's dose, so I'm gonna call the doctor and see what he would like us to do, if he wants us to hold off today, or if he wants to go ahead with a dose today or not. And lots of times before people get all those involved, they'll come clean if they are manipulating. But if they aren't, it's the physician's final call, really. You could call and let me know, and maybe I could call a physician, or if I'm not here, one of the other nursing staff, or you guys may have to call them and just say, look, this is the situation. What would you like done? It's not an error on our part at that point because we didn't administer it that way, and we didn't fill him any medicine because we're not a pharmacy. So we would just see what we need to do from there. So it's not an error on our part. It would be an error either on the patient or the pharmacy. But we would document what we have in our hand. We would say, oh, doesn't matter if your bottle says 12, you have 11 here. But all that always needs to be reported to the nursing supervisor and to the pharmacist if it's a situation like that.
Do you recommend counting their medicine and running in?
Always. I mean, yeah, if they bring in something, you actually need a witness with an employee is the best way. So like, if you and Jordan are working and somebody brings in a controlled thing, you can just say, hey, look, I got 1, 2, 3, 4, 5, 6, 7, or whatever. Or I've got 1, 2, 3, 4, 5, 6, and then look, here's an empty packet because they said they took one at the pharmacy. Now that'd be okay because then if they took it at the pharmacy, we could say, okay, so you took your dose for today. We would mark down brought in number 6, self-dose number 1 at the pharmacy. And then we would say next dose on 2/4 the next day. And then we would, and that way it would be set in motion there. So make sure you correctly document that. Okay, so we're starting back at task 3.12 on duty area 3. Storing and securing medications. Drug prescription containers. So that means that whether they bring in a pill bottle or a punch-out packet, they have to be stored in the original container. We don't accept medications that come here in a baggie with no label. We don't accept drugs here that come here that look like a bag of Skittles, like there's 50 different meds in one bottle. That won't work. So it has to be in the original container, and the labels have to be intact and readable. So if we cannot see it because they kept it in their pocket and then grandma washed it up in the wash, we don't know what it is. And we can never change a label, only the pharmacy can. So, and the importance of storing medication properly is complying with federal and state laws and complying with licensing agency regulations. They need to be stored centrally in a locked cabinet or refrigerator, and the individual in charge must keep the keys on his or her person. So if you're doing the meds, you need to have the key to get into the med room. Keep controlled substances under double lock. That is a federal law, but we do every medication under double lock. Do not write on labels. This is a function for a licensed physician or pharmacist under the Virginia state law. If anyone else labels a container, it is a misdemeanor. So this stuff is serious. So if it's in an unlocked room, there has to be a container that's locked, like the filing cabinet would have to lock, and then the individual boxes would have to lock, so they'd still be double locked. And now if the room would lock and the cabinet would lock and then we didn't have that other door that locked, that would be okay, as long as the cabinet locked. There has to be two lock mechanisms in the way of those medications, something.
Bring in like a bottle of Tylenol.
Unfortunately, no. We have to have a prescription and order. Now, if the doctor writes an order, that's fine. We could do it that way. But the doctor has to write an order and say Tylenol, was it 325 milligrams? It could be, 2 tablets every 6 hours as needed, and then it would be okay. But it cannot be something that don't have an order. So, we need to talk about disposing of medications. I'll just be kind of upfront. I like nurses to dispose of medications a little bit better than the medication aides. Not saying you can't. It's just, when you're disposing of meds, you're kind of sticking your neck out and saying, yeah, I disposed of them. You could be a witness. That's perfectly fine. And you can dispose of them. You always have to have a witness. And in the downstairs in the med room, and anywhere you work, there should be a binder or some kind of system in order to record what medication you're disposing of, the directions how it was taken, who it was prescribed to, the date you disposed of it, and how many you disposed of, and how you disposed of it. That is in a black binder downstairs. It says medication disposal log. Now, those logs have to be kept in the facility, I think, a minimum of 5 or 7 years. So they have to be kept. We have something called a drug buster jug, and it's a jug full of activated charcoal. It's the same stuff that if somebody was to overdose, that's the same stuff they put down their stomach in order to neutralize the medication, and then they suck it back out. So it's the same stuff. When you put it in that drug buster jug, it's supposed to neutralize the medication. It's actually supposed to be, the bottle says it's safe to throw away in the regular trash. You want to always check with your state laws, regulations, and maybe OSHA regulations on throwing some of that stuff out. So everything should be disposed of. The only thing you can't throw in those jugs is medication that fizzes. So like a Tums, something that would fizz, or an outlet seltzer. Because it will cause the jug to expand and blow up. And that would be gross, because those things stink. So why would you want to dispose of a medication? It's expired. Doctor discontinued it.
Maybe they had an allergic reaction or something recently.
Okay,
So
so
I think if you drop it, like
if you drop a pill, I'm going to tell you this, and this is just being real life with you here, okay? And I know we're recording, but I'm going to do it anyway. It's real life. If you drop a pill, you're not supposed to give it to someone, because it's something going into somebody's mouth. They're ingesting it. So it'd be like giving them a piece of food that you dropped off the floor and giving it to them. That being said, I cannot tell you the times that I've been in front of a patient, dropped a pill, and I will be like, let's just dispose of that and I'll get you another one. And they will pick it up, blow it off, and they'll say, that's okay, it was just on the floor for a second. And they'll take it anyway. I do not encourage people to take pills that fall on the floor. Yeah, at home, this is an industrial place. I mean, you have a lot of shoes walking across these floors. It's been to Walmart, Target, through somebody's vomit in the Walmart parking lot. You know, a lot of gross stuff. And we're in the middle of COVID. But I have had patients pick it up off the floor and take it. And I don't encourage it because it's gross, it's unsanitary, it's not standard. But what, what can you do when they pick it up off the floor and then they put it in the mouth? It's their medicine, it's their body. We can advise against it, but
think they could just present on them, out of the medication early, that's what they're afraid of.
that's probably a big reason. But if something like that were to happen, what we would do is we would call the pharmacy and the doctor and explain the situation. Hey, I was giving out a medication. It just slipped right out of my hand and hit the floor. I had one time a medication somebody called me about. They were popping it out in a little bubble pack. And when they popped it out, they said it flew out of there like a bullet. And I've had that happen before. But it happened to fly out there like a bullet, land in the sink, and run right down the drain. And just thank goodness it was something that wasn't a controlled substance, but it still had to be marked as disposed of because there's no way you're going to get a pill out of a P trap in the drain. It full of water. It's just not, before you could ever get it out there, it'd be mush. So the best thing to do at that point was I advised them to just flush the drain out good. Make sure they dilute that because you're not supposed to put medications down the drain. So, even if it's an over-the-counter med, it needs to be disposed of. It's disposed of in the same way.
What about eye drops? Or nasal spray, like Flonase or something?
If it's like nasal spray in a glass bottle, I would recommend putting that in the biohazard. If it's like eye drops, you can just squeeze those right down into the drug buster jug. So when a client leaves the facility, any medications given to the client or caregiver should require the caregiver's signature indicating the caregiver understands and accepts responsibility for the medications. And we have that on our discharge. When they sign the discharge, they're saying that they take responsibility of their medications and that they've returned all their valuables or our items and they got their valuables.